Hello and welcome to the Windsor-Essex Compassion Care Community Movement. This community is working together with a unified vision to help newcomers, caregivers, and those who are elderly, disabled, isolated, or approaching end of life to get the support they need to live well. What is WECC? At its roots, it is the simple act of a community asking its citizens what's most important to them and helping them find ways to address the challenges they face. To support access and uptake, WECC is now a backbone community-wide service that encourages people to ask for the help they need while sharing their skills and talents with others, supports people to organize their own personal network of care to achieve their most important goals, if needed, helps people navigate community programs and connect with friends, neighbors, youth, and community volunteers for ongoing social and practical help, and builds community attachment through regular check-ins to ensure each person has the help they need to make progress on their goals and to feel like they are living well. The following simulation has been developed to give you an understanding of how the WECC model works today. Today we are going to walk through the process step by step with Shirley, who is a real participant in our WECC community pilot. Every client's story is different and encounters will be personalized to their unique circumstances and interests. However, the steps and flow of the information are similar.
Hi, my name is Shirley, and this is my situation and why I need compassionate care, community care. I was recently diagnosed with ovarian cancer, the first one in my family with cancer. It was quite a journey for me, knowing that I had it. Through the surgeries and through the complications afterwards, I was left with knowing that my normal was gone, and I couldn't find it, and I had difficulty adjusting to not being able to be myself and not being able to do things that I normally did, and not knowing where to turn for help. And to me, hospice was end of life thing, and I'm not quite there yet. I'm fighting. But they came into my life at the time when I needed them. They were the resource I needed, and to get back on track, to find a new normal, to find a new way to do things, step outside of myself of asking for help that I wasn't normally doing. I'm very independent. I didn't know where to really turn until they came up and introduced themselves. And this program was my lifesaver, is my turnaround point. It was my eye-opening adventure, realizing that I wasn't alone. There was a lot of people in my life. When we started doing the circle of community, it just doesn't affect me. It affects my daughter, it affects everybody, knowing that there was a number of people in my life that I really hadn't counted on or really knew that they were there. And that was a really eye-opener, knowing that I wasn't alone in this journey.
Usually the first step in the WECC process is for each person to assess their own quality of life, understanding that this is a journey that lasts a lifetime. The WECC Quality of Life Survey allows people to reflect on multiple dimensions of quality of life, including personal well-being, perceived health, disability, social connection, experience of care, distress, and for people with serious illness, the physical, psychological, existential, spiritual, and social impact of illness, as well as personal dignity. For caregivers, caregiving burden is also assessed. The WECC survey tool uses a number of existing validated survey instruments or questions blended together to reduce reporting burden. The Hospice of Windsor-Essex is a founding member of the Compassion Care Community Movement. Hospice is also one of the first agencies in our community to integrate the full range of WECC services into existing hospice operations. Shirley has come to Hospice for support. Hi Shirley, welcome to Hospice. I'm Amanda. I'm a fourth-year nursing student at Hospice. Hospice is very serious about measuring the quality of the care we provide to you. In terms of our impact on your quality of life and experience, we are asking you to complete a quality of life baseline survey as part of our intake to hospice. By completing this survey, you will be more aware of your health and care experiences, receive information about your quality of life challenges that you can share with your providers to help them organize your care, and your non-identifying outcome data will be used to keep track of community progress in improving the quality of life for people like you. It should take about half an hour of your time and you will get feedback on results. You don't need to answer any questions that make you uncomfortable. We can do it online together now.
That sounds very useful.
Okay, thanks so much for your time. Here's your report. You can use the information in the report as feedback for improving your own quality of life. With your permission, I will give a copy of your report to your team at Hospice so they can help you address the challenges you are experiencing now.
Yes, you have my permission. I want all the help that I can get.
You should also be aware that our community is now keeping track of our shared progress in improving quality of life for people like you. Do you give permission for your non-identifying information to be used as part of the Community Quality of Life Tracker?
Absolutely. I want my voice and experience to matter and to help others.
Would it be okay if Windsor-Essex Compassion Care Community contacted you in the future to tell you about other studies, programs, and activities that you may be interested in participating in?
Sounds interesting. I don't mind listening to what they have to say.
The second step in the WECC process is to identify people who could benefit from coaching and navigation support to optimize quality of life now, reduce unmet needs, and plan for future wishes. Each month, Hospice and other community pilot agencies have agreed to review new intake as well as current clients to identify at least 10 clients they believe could benefit from WECC. Diane is the Hospice WECC program lead and Eleanor is the WECC coordinator for Hospice.
Hi, Eleanor.
Hi.
I've met with the office, hospice office intake staff to pull together a list of clients that we would like to offer them the Sharing My Journey program. We've identified Shirley and 9 other hospice patients who have life-limiting conditions and they are isolated. And so we think that they would be good for this program. We have 6 of them who have completed the quality of life assessment.
Okay, we certainly do have spots this month to be able to introduce the 5 clients, and we're actually going to use a lottery system to allocate the clients, and then I'm going to find the specific students as well as the specific volunteer community members that's going to go with the specific students to come and meet these clients.
Great.
Okay, wonderful. And then we'll start booking appointments as soon as we can.
Sounds great. Thanks,
Awesome.
Eleanor.
Thank you. Thank you.
Once people are identified, the WECC team at Hospice follows up with each client.
Hello.
Hello, Shirley. My name is Emily. I'm a student with the Hospice Sharing My Journey program, which is part of the Windsor-Essex Compassionate Care Community Project. Your team at Hospice asked me to call you to let you know about this program and offer you the opportunity to participate. If you are interested, you will receive coaching support from trained community volunteers to help you organize your care around what's most important to you in order to achieve your best possible quality of life. We can help you find community resources and connect with friends and neighbors, youth, and community volunteers, to get any extra help you need to live well. This is a very flexible service. We're here to serve you, and we will make every effort to fit your preferences. You will be able to move through the program at your own pace. Some people are able to complete the program in 2 hours or even less, while others like to connect with their coaches over several visits. The choice is yours. There is no cost to participate. You will be asked to sign a consent document giving permission for us to provide feedback to you on your results, and if you wish, to share your information with your team at Hospice, as well as others you may choose to designate. We will also ask for permission to use your non-identifying information to keep track of the progress Hospice and the community is making in improving quality of life for you. Do you have any questions for me?
No, not right now.
Can we go ahead and schedule a visit?
Sounds interesting. I don't mind trying a visit and seeing what happens. I can decide afterward if it's worth continuing.
Okay, I see you usually participate in the knitting club at Hospice. Do you want to book an appointment either before or after the club meets next Thursday?
I don't have transportation this week. Can you visit me at home?
That's no problem. Thank you for your time, and if you have no other questions, we look forward to seeing you on Tuesday at 3:30 in the afternoon.
Hello.
Good afternoon. We are with the Hospice Sharing My Journey program, and we have an appointment with Shirley.
That's me. Come on in.
All right, thank you.
Hi, Shirley. Thanks again for letting us come in to visit you.
Yes.
So my name is Eleanor. I'm the coordinator with the Windsor-Essex Compassion Care Community. Let me just give you one of my cards, and I'm going to allow our two students to introduce themselves. You've met them through a phone call, though.
Yes.
Hi Shirley, I'm Amanda. I'm a nursing student with the Windsor-Essex Compassion Care Community.
Okay.
Hi Shirley, I'm Emily. I'm another nursing student with the Windsor-Essex Compassion Care Community.
You as well.
And they're both fourth-year nursing students.
Oh, excellent.
So what I'd like to do is run through what we'll do today, and I'd like to get your written consent for us to be able to have you to be part of this program. Okay?
Yeah.
So when you had spoken to one of the ladies in the previous conversation on the phone, you had allowed us consent to come in to see you, and what we'd like to do is actually get your consent to be part of the program. The two consent forms that we need you to sign is one to allow us to register you, okay, and to be part of the research program. The other is to allow you to, for us to disclose information to your caregivers. Okay, so we'll just fade out at this point, and you're good to consign, to sign?
Yes.
Beautiful. Excellent. So, and with the survey that was done with Amanda over the phone, we actually have your survey results. And, okay.
Oh, I see.
So this just tells you the results of your survey.
Oh, very good.
And we can leave this with you to read over.
Oh, that'd be great. Thank you.
So from those survey results, we actually will get information and we'll work through with you what your concerns are based on those results and what your goals will be and how we will set those goals with you, and you'll identify for us what your priorities are, and then we'll identify the resources in this community for you. Okay?
All right. Sounds
All
good to
right.
me.
Awesome. And so the next part is to actually ask you what your skills, talents, and strengths are that you can assist with the community. So we'll just let Amanda go on this part.
Okay, so Shirley, the answers to the questions will be kept private and securely stored in your own personal health record.
Okay.
We will help you guide you in building your care team and developing strategies to achieve your goals. So we will work through the development of your own personal life plan, and we'll give you a booklet that looks like this that contains your plans for easy reference. So are you okay with us beginning the questions?
Yes. Sounds good to me.
Okay, so our first set of questions are asking about your strengths, skills, and talents. So can you identify some of your strengths for me?
Some of the strengths are talking to.
During the patient visit, Sharing My Journey volunteers will document what matters most to the person and their health, paying attention to all holistic care domains through a structured conversation format. Support clients in goal setting and navigating access to formal and informal resources to achieve their goals. Encourage clients to document their future wishes using the Ontario Speak Up resource and to discuss their wishes with the people closest to them. Summarize client information in the form of a lifelong care booklet. If the client is managing the use of computers themselves, introduce them to the personal health record and survey applications. There may be times where the patient may want to discontinue the interview and continue at another time. The computerized applications, including the surveys and personal health record, may be conducted during more than one visit, based on the client's preference and availability. Note that once the client identifies who their intended quarterback will be, if they choose this approach, the third visit will be used to transition oversight of the person's plan to that person to ensure they can stay on track for achieving their goals.
This makes me sad that I can no longer manage my garden at this time. I used to play cards, but I don't able to do that anymore.
Well, we have some suggestions for you to consider. Why don't we post your request for help cleaning up your garden on our WECCC Compassionate Neighborhood Exchange in Our World? I'm sure we can match you with a WECC youth volunteer we can get to help you with this. There's no cost for this help. There's a card group also that meets every Friday at the community center. The church you belong to is a WECCC Compassionate Neighborhood partner. We can
if there is anyone there who is willing to drive you to that each week. Or in an alternative, perhaps you could offer to host a card game at your place every week and invite members of your church or hospice who also love to play cards.
You did a wonderful job setting some really great goals for what you would like to see change over the next few months and developing a plan of action for living well. At this point, do you have any questions for us?
It wasn't as bad as I thought it would be. It makes me think about things that are going on with my life.
Okay, so as part of your service and with your permission, we will share the information about your quality of life results, who's part of your circle of care right now, and what your goals are with your team at hospice. They will review the information about what's most important to you and what your challenges are, so that they are informed about how they can best help you. Is it all right if this information is shared with your team at hospice?
Yes, it is.
I know it's sometimes hard for you to travel. Is it all right if I let a hospice coordinator know that you're willing to receive your visits virtually through Live Care Connect if they have any questions they want to ask you?
Yes, that sounds good.
With Connect, you can visit with your team from the comfort of your own living room. We'll be right here with you to help you use the system until you get comfortable using it on your own. Is there anyone else you would like to have access to your personal health record, like your family doctor, for example?
That would be helpful, yes.
Thank you once again, Shirley, for making time for us to visit today. We wanted to give you a little token of appreciation from the community for the time you have spent with us. We also have a graduation certificate for you, which shows you are now registered and an active participant in the Windsor-Essex Compassion Care Community Movement. As we discussed when we developed your monitoring plan, part of the WECCC service is to provide regular check-in calls each month to make sure that you have the help you need and are making progress on your goals. We would like to schedule up a follow-up visit with you. How is 4 weeks from today?
That would be perfect.
Well, thank you for your time again, Shirley. We look forward to our next conversation. In the meantime, if you have any questions or concerns, please do not hesitate to contact us in any way to help you out.
Thank you.
When the visit is completed, volunteers will communicate either by phone or in person with their WECCC coordinator to inform them of the visit outcome and update the client tracking form, summarize client information in the form of a WECCC booklet, ensure information is stored appropriately in the WECCC Community Registry and the person's personal health record, prepare provider reports and follow up with the clinical team to share information as directed, follow up as required with requests from the help of neighbors, youth, and hospice volunteer services. The WECCC coordinator supports volunteers by being immediately available if anything unexpected comes up during a visit, obtaining feedback on how the visit went for them and providing a debrief, at the program evaluation visit, connecting back with the client directly to ensure their needs were met and that the volunteers performed in a professional manner and gave instructions that were understood throughout, and overseeing the quality of the documentation of client interactions.
Hi, Eleanor. How have the visits been going with Shirley?
Actually, the visits have been going very, very well. The two students have connected very awesomely with Shirley, and there's a good relationship with them, working relationship with them, and Shirley is progressing very well towards completion and graduation. There has been some triggers, there are concerns that we're going to need some assistance with Shirley, and one of them is with social work. So I'm wondering if perhaps we as a team can work through those things that so that Shirley's needs can be met. Okay?
That sounds great.
Present some options to her.
Yes, please. Maybe from the social work department, that would be awesome. And then also transportation so that she can get to doctor's appointments. So that'll be from the volunteer department, is that correct?
Yep, we will contact them.
Awesome. And then as well as her diagnosis progresses and she reaches out for us if there's any symptoms that need to be managed, and we'll need to, I'll let you know through Shirley. Shirley will identify for us if there's any symptoms that need to be managed for her through our team.
Okay.
Okay.
You'll let us know.
Yes, I will keep you
That's
updated.
great. Thank
And
you.
we'll do that with all of the clients that hospice has.
Wonderful. Thanks, Eleanor.
All right, very good, thank you.
Sarah, remember you told me, we discussed about how you wanted information on my health concerns or any of my medicines and my doctors? This pamphlet has got a plan and set up everything on a website that you can access.
Oh, interesting.
So you always wanted to know who my doctors are, where my medication is, or what my plans were for funeral or anything like this. It's all in this website that they provide this booklet. And this booklet is in chapters, is in every section. It shows you the resources, the people that I reach out to. Shows you my doctors and specialists that I deal with. And so that my advanced care plan, you know what my plans are.
Yes, exactly.
Yeah, and this is also good for you as well. So if you want to set your own family up, I know you and Dan talked about this. Yeah. So I think this is an excellent idea for you to follow through, and this way you have access.
That is totally awesome.
And if you wanted to actually go through the same program for yourself, Sarah, you and your sister, Deb, Sarah, you can ask us for the same program and we will provide it for you, okay?
Awesome, yeah, that sounds good. Sounds really good.
Very good.
Hi, Shirley. I'm a student volunteer with the Windsor-Essex Compassionate Care Community.
And your name is?
Colton.
Colton, nice to meet you.
Nice to meet you. Using the Our World program, I was able to see that you need assistance with your garden and getting it set for the winter.
Yes.
Through the Our World program, I offered my help and received a phone call from the mobilizer and facilitator. He sent me here to assist with your garden and to allow me to gain my community hours.
Oh, excellent. That's great because I do have the bushes, I do have the annuals that need trimming, and I need the weeds pulled, so I need the garden ready for winter.
Okay, let's get to it.
All right.
Hi, it's Amanda again from WECC. I just wanted to check in with you today to see how things are going and ask if there's anything more in the community can do right now to help you. Is there anything you wish to ask for help with over the next coming month? Are there things you would like to offer anything you would like to offer to help to others? And has anything changed in your situation within the past month? We also want to check about the progress you are making in living well. Well, Shirley, based on the information provided, it seems that you are still feeling in some distress. Let's update your WECC booklet with this information and inform your hospice team. Do I have your permission to share this information?
By all means, yes.
Thank you. Have a great day, Shirley.
Hello, Shirley, how are you?
I'm doing fine, Eleanor. Well, sort of fine.
Yeah, sort of fine?
Yeah.
So a year has passed since we've seen you, and I know we had the contact with you by phone.
Yes.
So, and then we had the contact with you about a month before, and we had done the survey to see how you've been doing.
Yes.
And with the survey, there's results that came back, and I want to meet with you, I want to review those survey results with you. And I think when you look at these survey results and you look at the survey results that we showed you before,
yes,
you're going to be quite pleased with how you've progressed.
Awesome.
Okay. So when we look at them, it's kind of neat. So here's where you were, and then here's where you are now.
Oh my. I didn't realize. I know I'm feeling better about myself.
Right.
I'm using tools that you taught me.
Right.
So I didn't realize the progress has been that far. It's awesome.
Yeah.
Yeah.
Yeah. Well, you know what? You did all the work. You did. You took all of the tools that we gave you, and you thought, this is something I can do, and you took them and you ran with it.
It was
doing
awesome.
it your own way.
It was great. I'm really very grateful for that.
Nicely done.
Thank you.
Yeah.
WECC is a service that is owned by and managed on behalf of the community. It doesn't happen without a high degree of community commitment and collective action, including citizens and caregivers willing to trust the community and share their outcomes, agencies and associations willing to recommend WECC to their members, student placements with WECC through the university and colleges, mobilized youth and retirees who are passionate about making a difference in their community volunteers who are willing to take on new roles, WECC volunteer training and coordination currently managed through Hospice and behalf of the community, compassionate neighborhoods growing within a multitude of buildings, faith and cultural communities, senior groups and community associations, shining the light on compassion recognition events, citizens planning meetings, growing numbers of wellness and neighborhood pubs, dedicated coordinators and a formal project management office, and more. Possibilities are virtually endless. WECC utilizes any and all resources and assets that already exist or naturally occur within communities and neighborhoods, and can be combined without duplicating other initiatives. There are no barriers to getting started. All it takes is a collective desire to improve and a willingness to act. It makes us proud to be a part of a community that cares. That concludes our vignette. Thank you again for being a part of the Windsor-Essex Compassion Care Community Movement.